He performs some of the most advanced urogynecologic procedures in Central Florida. Dr. Stanley, founding physician of the Center for Gynecology and Pelvic Surgery at Florida Hospital Waterman, is among the most accomplished in his field.
A lot of our exam is, pretty personal and intimate, and I think the main thing is talking to the patient, first, before she takes her clothes off, and getting a sense of what she's really worried about. Explain to her what you're doing and why you're doing it. I think that as long as they understand what's coming up, then they're much more amenable to a different type of exam. I grew up with a lot of women who were just really strong-willed and very impressive women. So a chance to work with women is nice because they just are so much more proactive when it comes to their own health. They come in with a problem. And they're also actually much more conducive to guidance and working with a team to improve their health. Back when I first started training, I'd have a gynecologist for the uterus issue, a urologist for the bladder, and a colorectal surgeon for the rectal issues. So urogynecology encompasses all those specialties, and in a sense it's more efficient. Other conditions that urogynecology treats, not just leaking and pressure and prolapse, but also function. So painful periods caused by either uterine fibroids or endometriosis. Chronic pelvic pain is a real common problem that we deal with. The age group, the women that we treat typically fall into two categories, the pelvic prolapse and pelvic function issues with leaking and problems with that, typically 60, 70 years old. The other issues, ages from say 18 to 40 are more pain and period issues, those sort of problems. I mean, we have women who are 90, 95, 100 years old who, for whatever reason, are having problems, and they're active, they want to do things, they don't want the bladder running their life. I mean, there's a lot of things we can do and a lot of treatments we can offer that are applicable to any age. And you should never just say, well, someone's too old for this. Patients, once they get into our system, they really like the staff, they like the convenience of being here at the hospital. If I do my job really well, we see her for a couple months and then we don't see her again because we've cured her problem. So what we did, we brought Stacy in to provide well woman care. Stacy, she's our nurse practitioner. She can handle all the well woman care issues. So routine pap smears, breast exams, birth control, everything from adolescence to old age. We want to figure out what's the best treatment for a patient, and that's one thing we do tell patients is that when you come in for an evaluation, it's a good hour between the time you sit down, we talk, we do our exam, we formulate a plan, because usually they've bounced among several doctors before they come to me. They've seen their primary care doctor, they've seen their GYN doctor. By the time they get to see me, they've been kind of through the ringer, and some of them are frustrated, some of them just want an answer to what their problem is, and no one's been able to give them an answer. Or sometimes patients just want to know what was going on, and they don't want to do anything. Over half the patients that we see do very, very well without surgery. Sometimes the best surgery you have is the one you don't have. So if I can make you better without surgery, that's probably in your best interest. Now, some people will get a nice result with physical therapy or medicine, but they're just not where they want to be, and at that point they say, you know what, I just want I want this to be fixed. And the only way we're going to do that is with some surgery. And then, doing a surgery that, a few other people can do and make it work well and get that patient happy that she came to see me.
When out of the office, Dr. Stanley and his wife are runners, training for marathons throughout the year. One of his proudest achievements is the Donna. 100% of the proceeds go to benefit breast cancer research.